Afternoon, everyone. This is Cindy, and today I'll be discussing the autonomy development of surgical robots and analyzing the trend from the regulatory perspective. So, surgical robots rely on the computer assisted surgical system, which also called robotically assisted surgical system (RAS). So, before diving into the study I'm going to present, let's review the FDA's definitions about RAS. So, RAS refers to the devices that allow surgeons to control surgical instruments, the device using computer and software and particularly in minimally invasive procedures. So that's how FDA defines the surgical robots. But the surgical robots have evolved a lot since the first robot received approval in 1993. So when speaking of surgical robots, the Da Vinci surgical system may come to our mind first. So but with advancement in technology compared to the Da Vinci surgical system, where the surgeon controls the robotic arms to perform the surgery, modern surgical robots are becoming more complex and autonomous. So, for example, the device on the right is called T-Solution 1, and it is used for joint replacement surgeries. And it also functions as a comprehensive planner because the device includes a 3D pre-surgical planning workstation software that allows surgeons to place implants based on patients' individual autonomy in a virtual environment. So the device is not just an assistant tool, but also has autonomy to adapt to different surgical environments based on different patients' autonomy. So here we can see how surgical robots have evolved and from the device that need full control by the surgeon to the robots that can offer a degree of autonomy and even assist with planning. So today I'm going to share this journal related to review FDA approved surgical robots and analyze the development of autonomy from a regulatory perspective. So about this article, as the RAS system continues to advance with the help of AI, we still don't have a comprehensive and updated guidance for surgical robots. So there is still a continuous need to assess the current guidelines to keep pace with advancement in robotically autonomy. So this article review all surgical robots approved by the FDA since 2015 to identify trends in the regulatory process. By examining these trends through a regulatory lens, we can better understand the developmental trends of surgical robots and prepare us to manage and streamline regulatory practice involved with this kind of device. So here is the method for the study. So the author collected records from the FDA 510(k) de novo and the Global Unique Device Identification Database to identify approved surgical robots from 2015 to 2023. And after a series of screenings, in the end, 49 unique surgical robots were identified. And the special point in this paper is that this 49 robots are assessed using the LASR criteria, which refers to level of autonomy in surgical robotics. So this criteria is for autonomy classification, and the scale was derived from a combination of peer research, regulatory frameworks, and emergent ISO and IEC standard. So I think it is kind of a valid assessment tool. And the author followed the flowchart here to sort these 49 surgical robotic devices into different levels, ranging from level 0 to level 5. And basically, the higher the level, the more autonomous the robots. So, for example, level 3 is known as conditional autonomy. And the biggest improvement at this level is that the robots can analyze patient-specific data, such as preoperative scans and propose strategies for performing the task. So it greatly reduces surgeons' burden, and the surgeon's role can be put more emphasis on evaluating the plan, the device proposes, and monitoring the procedure. So here we can move to the statistical results. So here's the result we got from the study. Among the 49 surgical robots, 42 were at level 1, which is about 86% of total. And additionally, 4 level 2 robots and 3 level 3 robots were identified. So, and from the figure below, we can see the since 2017, there has been a significant increase in the introductions of level 2 robots, and the number keep growing after that. And if we classify these surgical robots by the regulatory system, we can see the figure on the left below. About 90% of surgical robots receive 510(k) clearance. And there were 5 surgical robots without predicate devices, so they got approval through the de novo pathway. And when examined by specialty, robotic systems are widely used in orthopedic surgery. And since 2015, 33% of all new robotic systems have been designed for procedure like in spine, knee, and hip surgeries. And as I mentioned, there are currently 3 level 3 robots were identified in this study, and these are the most advanced robotic system that we currently have, and they are designed for prostate biopsies in urology, bone melding in orthopedic surgery, and hair follicle extraction in plastic surgery, respectively. So these are all involved minimally invasive procedures. So we can better assess the trend after analyzing the data and result we got from the study. So we can realize the surgical robots are becoming increasingly automated with the help of AI, particularly machine learning. And this innovations enables robots to create a patient-specific surgical plan and even perform certain tasks autonomously. And currently, the most advanced surgical robots we have are classified as level 3 automation. So let's take a look at our current regulatory framework and its challenges. So with the advancement of surgical robots, under current regulatory practice, the FDA classifies all surgical robots devices as Class 2 and typically clear them through the 510(k) process. And this classification indicates that FDA consider this device pose only moderate risk. However, with the increasing autonomy and incident involving errors in programming or video imaging issues, it has become evident that the existing classification and regulatory system we have for surgical robotics are not really comprehensive. And since most of the robotic devices have been approved through the 510(k) process, the focus has mainly be on technical features. However, this approach doesn't fully address the unique aspect of surgical robots, such as their autonomy, their role in medical procedures, or the interactions with the surgeons, with the human operators. So in conclusions, the field of robotics assistant surgery, RAS, and the autonomy of surgical robots are evolving steadily. As the technology advancement, it is crucial to develop parallel and up-to-date regulatory frameworks and surgical workflows, especially when it comes to the device with higher level of autonomy. So it's really important for us to understand the level of autonomy before regulating them. And from this study and combined with previous research, the LASR criteria may serve as a valid tool for us to classify and guide the development of substantial equivalence criteria for more advanced surgical robots. And here's the my conclusions after I review this article and relevant reports. So I'd agree that as we move toward more autonomous surgical robots, and the regulatory framework should be tiered according to the level of autonomy. And additionally, when establish the regulation, it's important to incorporate the feedback from the device developer and the surgeon, as they know the device well and have the real world insights into how robots are used in practice. And the last point I want to stress is that as robots become more autonomous, there will also be a need to address ethical and legal questions, because AI have bias, depends on its training module. So if there's something goes wrong with autonomous robots doing the procedures, it's hard for us to define the responsibility. So it's like, who's gonna take the responsibility for that error? So it's crucial to address these ethical and legal implications. And here other resources might be helpful for you to better understand this topic. So here's for your reference, and thank you for your listening.
Thank you, Cindy.